When searching for the right physical therapy clinic, many prospective patients will want to know whether or not that practice takes their insurance. In fact, it's such a common question that we receive at ResilientRx, we thought we'd make this video to help you gain a better understanding on how the insurance process typically works with PT. In traditional insurance-based PT clinics, also known as in-network clinics, there can often be limitations depending upon the specific carrier and plan a patient has. For example, there may be certain situations where some services are not covered. You could receive bills long after you've completed physical therapy, or there are only a certain number of visits authorized by the insurance company. And when certain services aren't covered or visit counts are limited, there are many times where the physical therapist has to get on the phone with someone from the insurance company to justify medical necessity for continued services. This takes precious time away from what matters most, caring for the patient. Since ResilientRx is out of network with all insurance carriers, we have the ability to have transparent pricing. There are no surprise bills that you'd ever receive later on, and we have the freedom to work with our clients on their own time, without the insurance company placing restrictions on services or numbers of visits. Let's talk briefly about deductibles. A deductible is a specific amount of money that the patient must pay before an insurance company will pay for a claim. If you have a high deductible plan, let's say $5,000, then you may be paying out of pocket anyway for each visit during your entire course of PT. Let's say your copay, the amount you owe every visit, is $50. In the traditional in-network model, you're often coming 2 to 3 times per week, which means you're spending $100 to $150 each week. And we argue that if you're not seeing a physical therapist one-on-one, your visits tend to be less efficient, and it may take you longer to get better. We'd like you to consider this. Since we only offer one-on-one care with doctors of physical therapy, we feel our visits tend to be more efficient, which means our clients come less often and they get better faster. That means less expense in the long run, less time away from home or work, and better quality care. What's the main takeaway message from all this? We work for you and not the insurance company. We hope you found this video to be helpful in answering any questions you may have about insurance. Feel free to reach out to us and we'll be happy to walk you through the process and answer any questions you may have.